So welcome to another one of our ABHI in Conversation series, where we've been speaking to senior leaders across the health and care system in the UK and beyond. And today I'm really pleased to be joined by Ian Bullock, who's Chief Executive of the Royal College of Physicians. Ian, thanks so much for finding the time to join us today. It's good to see you, if not actually in person. Look, let's start with Royal College of Physicians. Everyone's heard of you. Many of us have visited your wonderful facilities in Regent's Park, I think, where we enjoyed a very good 30th anniversary celebration with ABHI a couple of years ago now. But just tell us a little bit about who the college are and some of your work.
Yeah, thanks, Richard, and great to be with colleagues at ABHI. The College of Physicians has been around for over 500 years. It was established in 1518 by Henry VIII, and the irony is, having just recently celebrated our 500th birthday in 2018, is the purpose of establishing it is still as relevant today as it was then, and that was to address variation in care, and it was about standards of care. So the college has obviously modernised over those 500 years. It's important that we keep looking to the future in the way that we build relevance, in the way that we engage our members. We're just moving through into a new strategic period where we're focusing, having asked the membership what's really important for the college to do, to really focus on educating, on influencing and improving. And if I talk, very briefly about each of those, obviously educating is the whole context of post-basic development and speciality development and supporting those 33 subspecialities of the physicianly community. It's about planning for the future workforce. The innovation of introducing the physician associate as a really important addition to the workforce has been crucial. And then the education and the continuing professional development activity we do through to master's level with a number of academic institutions. And then influencing, we do a lot of that, both in government and right across the medical and healthcare communities. Policy influence is important to us, so inequalities in health has become a really key focus for us. That's one of the reasons why we're excited about also opening a new home in Liverpool to help the city and the region there address some of the access to health issues. And we also are really focused on things like sustainability, clean air, environmental awareness, as well as key burdens on the health system like obesity and some of the key disease areas. And then the whole improving thing is partnerships, strategic partnerships with the healthcare quality improvement on running lots of the big national audit programs, driving data to improve clinical practice and patient experience. And then also focusing on the generation of evidence with our contract with the National Institute for Health and Clinical Excellence around social care and healthcare guidance, system redesign, and also really committing to the whole quality improvement agenda. So that's it in a nutshell. But the bottom line is we have to stay relevant to both trainees and to older clinicians. Issues like, appealing to the younger generation as well, staying relevant to the older generations in healthcare is really great. But we've just celebrated passing through our 40,000 member mark, which is great. We're growing month on month, and that's brilliant for us, Richard.
Well, that's great. 40,000 members is seriously impressive. And Ian, you mentioned a lot of things there that will resonate with people watching or listening this. And a lot of them, we've set out our sort of own vision, and we've got a number of challenges, board-led challenges. They include things like sustainability, like tackling inequalities, and like that area of collaboration, or big areas of work for us. Just before we move back, just to take you back to one thing, workforce has been it's the biggest challenge that the service has faced consistently. You mentioned something I think really interesting for me there, the role of the physician associate, and we talk a lot, don't we, about people absolutely needing to operate at the very top of their licenses. Do you want to say a little bit more about that type of role and how a workforce might develop to deliver the health and care system in the future?
Yeah, well, we've been collecting workforce data for at least a couple of decades through a particular unit in the college. We regularly survey the membership and we produce a census both for our own physicianly community and the two sister colleges in Scotland, in Edinburgh and Glasgow. So we have a lot of data that generates a clear picture on what the issues are, and that is there are not enough doctors. There is a more modern trend around part of whole-time equivalent working, particularly in female doctors. We also know that every 2 out of 3 students in medical school are females, and it's about providing the right opportunities for growth and progression, committing to the whole equality and inclusivity and diversity agenda, and making sure that we can position people to be able to work in a way that works for them also. We've campaigned for doubling the number of medical students at universities. That's beginning to resonate with government. I think the workforce is on its knees, post-pandemic and pre another winter. And so it's really important to understand how we help support people's sense of well-being, how we provide support to prevent burnout, but also to provide those sort of community areas of support in regions all over the country. The physician associate was really a commitment that we made about 4 to 5 years ago and have established the faculty. It's growing year on year. There are over 30 universities that are producing M-level students who are transitioning from a biomedical first degree into a master's equivalent. And we run the faculty and deliver the final exam that makes them competent, I guess, for clinical practice. That is general, that's focused on providing general physicianly care. So particularly in areas of burdens of disease, like in the elderly and in frontline medicine. But you're bound to see a subspecialisation of that, and we can start to see that in places like intensive care, critical care, emergency care, and of course the government's main focus is to support primary care with the development of physician associates. So I think those are really key areas for us on how we try and make sure that the work that the college does as a professional body really equips the future workforce to meet the needs that society has. It's moving through regulation, through statutory processes in government. It will be a professional body that is governed and regulated by the GMC. So we're working very closely with them in Health Education England to make sure that the physician associate is here to stay, a bit like some of the innovative nursing roles around, the consultant nurse and some of the advanced practitioner type roles that are also being embedded in regulatory process. So we're trying to do all that we can to make sure that there are enough workforce numbers to meet the healthcare demands and needs.
That's great. It's really interesting, and I think people will watch that with interest and a recognition that there are different ways beyond the traditional to deliver the workforce we need, modern apprenticeships, all that kind of stuff. And I think that you segued us nicely into the next thing I wanted to ask you about. We're recording this towards the end of May 2021. We've been speaking to everyone about the response to COVID. You mentioned the workforce is kind of on its knees. Just give us your perspective on the journey your members have been throughout the pandemic. I don't think we're out of the woods yet. I know the service is planning for subsequent waves as we hit the winter again, but just some thoughts from your perspective on where we are and how we've coped and what might be next.
Yeah, I think huge bravery. In the early days, uncertainty about your own health. We've had a number of physicians in our RCP family, as we describe it, that have lost their lives due to COVID. Our own registrar, Professor Donal O'Donoghue, died very prematurely. At the back end of last year, that made a massive impact on the college. But the college has, through advice to government, Chris Whitty is one of our fellows, JVT is one of our fellows. We've supported that sort of really scientific and medical approach on how to guide and advise government to steer through what is, you know, something that none of us thought we would live through. It's a once in a century type act of God. It's a pandemic. It's stuff that we've read about but never lived through. And we've learned lessons on how to make sure that we equip our frontline clinicians through the early days with the challenges around PPE. The science that has gone with that, and members of our healthcare community, the RCP family, and their contribution to just the rapid innovation of science through to successful and effective vaccination programs, just amazing. And then the in-train research that we've supported through the different academic institutions that really provide that sort of narrative and learning on how we manage in crisis. That said, it's the human cost of the emotional impact, the physical impact, and of course some of the memories that will stay with clinicians, frontline clinicians forever. And it's how we support that workforce to really, you know, make that switch to getting back to regular frontline medicine and healthcare, and starting to drill into what are expanding waiting lists now, because we've had to throw everything at the pandemic response.
That's great and really interesting. Thanks. So just say a word maybe about how have you found training during this? I know, speaking to some institutions, mandatory training has been far from straightforward, things that you wouldn't think about, use of third-party providers that have just disappeared, not been able to get. What's your sense of how training has been able to hold up during all of this?
I think, you know, trainees have responded as well brilliantly. You know, they've been willing to sort of be flexible and adaptable, and we've tried to provide those support mechanisms in the different regional support mechanisms through regional tutors and the pastoral care really at a very team level. We've emphasised that. Pauses in training, moving into another part of training without the formal exams or sign off, that's all been part of the training experience. So it's really about trying to understand how we as the professional body support that and provide the capability moving forward on the provision of exams, the provision of specialist support that allow people to make those accession and succession passages through training, different training periods and demands. So the trainees committee is a very vibrant committee in the college. We listen, we respond, we work collaboratively with them. You know, they're no different to any part of the community. They're a really important voice because they are the future, and we need to understand how best to support them. So, you know, being off plan in your training plan is difficult, but they've been amazing in the way that they've stepped up and put their hands up and been really effective in part of the COVID response. So it inevitably will need to learn lessons on that experience and make sure that we embed those in the future.
Yeah, that's great. Well, lessons learned again is a theme I think we're all coming back to. We're working with ministers ourselves at the moment on a kind of innovation manifesto, trying to embed the best of what we learned, and as you mentioned before, the way people have been able to quickly adopt innovation gives us, I think, great cause for optimism for the future. So speaking of the future, I feel like I'm a bit of a scoop here. I spoke to people. I spoke to your colleague Andrew Reid at the Royal College of Surgeons in London recently, Royal College of Surgeons of England in London, just across the city from you. Yeah. And he was in a heightened state of excitement at the time, because he was just about to take the keys for the fantastic redevelopments they've done at Lincoln's Inn there. We were talking before, when you finish this, you're on your way up to Liverpool. You've got your own incredibly exciting initiative with the college in Liverpool. Tell us a bit about that and some of the facilities and the way people can perhaps get involved with it.
Yeah, I think when we were anticipating our 500th anniversary and Jane Dacre was president, Bod was our current president, was registrar, and a number of us were thinking, how can we be relevant for the future? And one of the regular criticisms was the London-centric nature of the professional bodies, and that was us included. And it was on the back of the rebalancing into the north, discussions being led by government. And we put out a call to 8 cities, 3 stepped up, and we went through a competitive process. And just the heart and the passion of Liverpool City Council to want to partner with us meant that we responded positively to that. So this has been a vision 5 years in the making. It was formally opened by the 2 mayors of Liverpool, Steve Rotherham and Joanne Anderson, with Bod and Clive Constable, my deputy, on Friday. It's a 13-storey building. It's called RCP of the Spine. It's right at the beating heart of a new knowledge quarter, which is around encouraging inward investment into the city. It's about the heartbeat of innovation. But more importantly, we want to create a hub where the key healthcare conversations can happen. So this is a property that we want to share with other professional bodies, organisations like yourself, so that rather than working in isolation, we can really animate those really key partnership-styled organisational conversations we need to have. So I expect to see organisations like other professional bodies, industry, organisations, policy organisations like the King's Fund using the building. We've got a state-of-the-art examination suite, which plays into the training commitment that we have. But more importantly, it's also exciting for us to help the City Council understand how you can design healthcare systems to improve access to health and also reduce inequalities in health. So this is about member engagement. It's a member vision to be in Liverpool, and we are so excited. We've got an amazing building which meets global standards of environmental sensitivity and well-being. It'll be brilliant for staff and visitors. It's a place where members and fellows can come, and I look forward to welcoming you there myself, Richard.
Well, we look forward to that, Ian, as well. And of course, it's great to see the investment you're making there. Liverpool was one of our great cities that's undergone quite a transformation, certainly during my lifetime, remembering Liverpool as it was in the 70s and 80s when I first visited it, to the real vibrant hub it's become, and a real conference venue as well. So hopefully you'll be able to capitalise on that. Ian, that's been fascinating. I promise we'll bring a delegation of our board up to Liverpool to have a look at the new facility when it's ready, and we must do this again. And we look to hearing more about the back end of the pandemic, hopefully a little bit more about those new roles you defined and also how things are going up in Liverpool. But thank you very much, Ian Bullock, for joining us today.
Thanks, Richard. Bye for now.